IHTV represents a single source solution for hospitals, vendors, applications developers to look at the needs of specific hospitals and look at the options and possibilities through a variety of companies and different organizations. It provides libraries, provides live demos. It allows you to sort through a large number of products, interfaces, integrations, all in one source.
So the Intelligent Hospital is really about collaboration and how we're able to bring together clinicians, engineers, and various vendors without regard to any particular technology or product, and how we can actually show that healthcare delivery can be specifically improved. And we really show that in very specific ways throughout the environment.
I agree wholeheartedly, and certainly the Intelligent Hospital Pavilion at HIMSS offers many different approaches on how to implement the Intelligent Hospital. However, within the hospitals themselves, we may have to question, is there that much intelligence? So informatics groups in hospitals, biomedical engineers, nurses, and clinicians really need to work together with industry. And the flip side is industry has to develop products in conjunction with the folks in the hospital in order to meet the needs. And sometimes industry may have to go into the hospital to have the hospital define their workflow and their perceived needs, and then together come up with an approach to intelligently manage each area of the hospital, not just the hospital in total.
And I agree 100%. I think every area of the hospital is different, and you need to have the specific skills from the physicians in that area, the nursing staff in that area. The workflow varies from area to area, and the integrations of the different technologies are all could be slightly different in all of those particular areas. So the IHTV really provides a repository or a source to look at these different scenarios and exchange ideas along these different scenarios.
And really then, kind of coinciding into that with IHTV and what that means to the Intelligent Hospital is really about educating and collaborating with people throughout the world without regard to time or place, and allowing really an opportunity to come in and access this information and this expertise on a far-reaching scale. And so we really look at the physician channels, we're looking at the clinician-specific areas, specialty areas that we're going to provide, and really including the vendors in that process, the engineers, as well as the specialists and clinicians that we have been talking about.
I think the benefits of an ongoing IHTV series that functions in a regular way is that the hospitals, the clinicians, the nurses, and others will come to realize that the Intelligent Hospital is and will always be an evolving process. And it is very important for the nursing and clinicians and others not to wait for a product to be perfect. The product will never be perfect. The product will always be evolving. The communications, the connectivity, the standards will always be evolving. However, at a certain time, just like all of us have smartphones and cameras and so on, we need to make a decision, make the purchase, and move along and continue development, not wait for the perfect product. And I think the idea of an IHTV programming that's ongoing will help consumers learn what's going on in an ongoing fashion and allow them to implement things along the way in a method that meets their needs.
I think in my experience is very frequently manufacturers work in silos. They don't interact with clinicians or staff at the level that they should, so they develop solutions that are very engineering based and functional, but do not fit exactly into the workflow. This gives them the opportunity to come to one place, interact with physicians online and offline, and develop their own strategies to fit their product to the solution that they're trying to develop.
And in speaking to the global aspect of this, just today here at the HIMSS 2012, I've spoken with people from China, Australia, Saudi Arabia, and that's just in the past few hours. So really what we're dealing with is a topic that has global implications for how we're going to deliver healthcare well into the future for really the entire globe in terms of healthcare. And the impact that IHTV can have on that will be significant because it really gives you a centralized repository of information and expertise to be shared truly in a global manner without regards to time or place, and really look forward to developing more content for that.
I agree. However, the global approach, certainly for informatics type technology, mandates that the informatics vendors come to the clinician meetings and interact with clinicians to show them what's going on. So for example, a program like the Intelligent Hospital, and specifically in my clinical area, the Intelligent Intensive Care Unit, is really not demonstrated in any of the USA or European critical care meetings. So hopefully, with the venue of IHTV, and in conjunction with demonstrations at clinical meetings, both medical and nursing, the clinicians will come to see the benefits of this approach and will champion these things within the hospital. Currently, we're depending on IT to champion it, and that simply isn't enough for IT to introduce a technology that the clinicians don't understand, don't know, and it doesn't fit in their workflow and doesn't improve things. So a global reach involves not just the global view of the world, but the global view of a hospital and approaching various meetings and venues and writings in a different way than we've done to date.
I was going to say the other option, we're talking a lot about how vendors interact with us. We also could interact with the clinicians and engineers at hospitals could interact with IHTV to look at the potential solutions that already exist and look at the variations that could be implemented and what one solution gives you versus the other, and maybe even defining what it is you want in the middle. So I think it gives us a lot of educational resources to further our knowledge about what we can and can't do.
Certainly from the clinical intensive care arena, which I would think would be a large piece of the intelligent hospital, because intensive care units like operating rooms are already very technologically advanced. IHTV would need to become a tab, an application of the critical care and maybe anesthesiology societies. So as people log on to those society web pages, there's a link into a whole new world for them that they currently don't have based on the society programming itself.
And I think moving forward for clinicians like myself and like Dr. Halpern, really having a repository of information that we can go to and say to our administrations and our IT departments that basically this technology is out there. It's being used in various isolated areas, and what we're really trying to do is bring it all together and change the way the facility works as a whole and the global view of a specific facility and a specific hospital system, and then starting to look even beyond that, how we're going to transmit data, share things with other clinicians, whether it be across town or on the other side of the world. And really this gives us a wonderful venue to do that.
Yeah, I think the IHTV has to be a very dynamic organization. Technologies change very quickly, and I think those technologies have to be reflected on the TV channels so that everybody gets a perception of how things are changing, where they're changing, and how they could imagine how these things could fit together. And then from the clinician side, they can provide their input on how they think these new technologies could merge to solve actual solutions and present solutions into the hospital.
Yeah, I think that's very important, but similarly, when one walks into a glorious exhibit like the Intelligent Hospital, one may get the feeling that they have to implement the whole thing all at once. And it's important to know that a piecemeal approach can be started within an organization to address the most pressing problems first, and then expand on those successes once people realize the solutions are very good. Otherwise, one could get paralyzed by thinking, oh my God, how can we approach everything in one shot?
And just the flip side of that, I've also found in having personally experienced grassroots level attempts at adopting technologies to solve individual problems. I think the reverse is also true. People feel that they're stuck with implementing one piece at a time, so that if you walk out of the pavilion, you're actually seeing individual products that are only speaking to the one problem, when really the problems are interrelated. And you look at something as simple as communication and being able to transmit key data in real time. How does that affect when I adopt one technology? How does that impact my EMR system? How does that impact my telemetry unit? All these different aspects of bringing it together. So we can maybe choose several different pieces to bring together because it does make sense in a coherent sort of an environment. And so because in a piecemeal fashion, it's going to take us several decades to implement all these solutions. And as we mentioned, it's such a rapidly evolving, you do have to take a step, and it's for each organization to decide what level of capital commitment they want to take and what are the goals. And we can certainly help lay those out for them. And through the Intelligent Hospital TV, it's a wonderful resource to begin that process.
And I think that speaks to the need for each organization needs a high-tech connectivity infrastructure that enables new approaches to be easily inserted into the system.
I think on the IHTV it's also very important that you demonstrate real technologies that are currently available, and maybe things that are eminently available, but not things that are overly futuristic, or else you get a blur of where you are and where you can be. I think all of us work very closely on developing intelligent hospitals. We look at developing new technologies in the hospital, and this is such an outstanding opportunity for everything to be focused and collated in one location so that we could pool our resources, get the opinions from everybody involved, technology, physicians, nursing, everybody, IT, and formulate products that are very useful.
And I do think that the Intelligent Hospital TV, IHTV specifically, will be able to really transform the way we have access to the data, the information from the specialists and the people that are delivering the products to really enhance our ability to bring to market things that are truly useful, and always remembering what it's about. It's not about the technology itself, but the delivery of healthcare at the root of what we're trying to do here. And I think this is an excellent way to move forward with that initiative.
I agree wholeheartedly with my two colleagues. Certainly IHTV, in conjunction with the Intelligent Hospital programming, will bring to the fore great new ideas and will help the delivery of healthcare and enhance it in ways that many organizations have not really thought about to date. So hopefully with IHTV and ongoing programming, people will be able to see each time they log into this a new idea, a new concept, but a doable concept. And the organization will see this is not futuristic 5 years, 10 years from now. This is futuristic today. It's just that the organization hasn't thought about it until IHTV and the Intelligent Hospital program has put it on the table.
And really, and just to follow that up, whether you're interested in patient safety initiatives, compliance with regulations and mandates, whether you're interested in EMR applications and how those will interface. Absolutely, and logistics of healthcare delivery, those are all going to be key, and really IHTV will be a wonderful resource for all healthcare.
IHTV is going to break the barriers down between the silos and the hospitals. It's going to let people all see the same information at the same time and be able to assemble it in a way that's unique to a hospital.